All right, we're recording live. I am Katie Sutton with PTA Plus podcast. Also, PT Pintcast will be airing this as well. Jimmy had to step out, but Russ and I, Russ Burns, are here talking at the Future of Rehab Therapy Summit. So he is a clinician, a community builder, a soldier, and a father of 3, and somehow still finds time to represent early professionals across the state of Ohio. Whether he's mentoring a new grad or leading troops as a platoon sergeant in the U.S. Army Reserves, he's about service, strength, and showing up. Now he's stepping into the innovation conversation, proving that frontline clinicians don't just belong in the room, they bring the most value to it. Today's guest is Russ Burns. Welcome back, Russ. You and I just talked not that long ago.
No, it was not that long ago, and here we are in D.C.
Here we are in D.C., so this is day 2 of the Future of Rehab Therapy Summit. I keep wanting to say Future of Physical Therapy Summit because that's what they had a couple years ago. And so it's just natural for that to, roll off the tongue. But here we are. So what did you think so far?
Well, it's been really, I guess, exciting to see people talking about things that they were very passionate about. Mm-hmm. And, one of the first things I noticed when we arrived is that our badges just have our names. Mm-hmm. And so I think that kind of takes who people are out of it. It's just a name, and you get to meet them and talk, and it kind of takes their position out of it. It opens up more conversations. And, I'm a PTA, and I'm around a lot of doctors here and business associates. And, they're listening to me as if I'm their peer. And I guess in some ways I am, but in other ways I just graduated. So it's a little bit intimidating, and it kind of took that factor out of it. So seeing people just communicate as if we all know each other, and we're all here to have the same outcome of learning about innovation and the future of rehab together has been pretty exciting.
Yeah. I like your observation. I didn't actually notice that until you said it, but you're right. It just has our name. Now, I think, let's see. Well, mine has, but of course mine is probably for the Leadership Congress as well. So that might be why mine looks different. But you're right. The majority of them just have your name. Mm-hmm. So there's no title associated with it. You get to present yourself as who you are authentically here and just kind of break the mold and talk to people. I think, and I don't know for sure, I'll have to clarify with Drew here that you and I might be the only 2 PTAs here.
Oh, wow. I didn't realize that.
Yeah. So I'll have to find out a little bit more information. But I think you and I might be it.
We're representing.
We are representing. We're trying our best to represent. So I really found yesterday's presentations to be very inspiring myself. Lots of really good ideas and thoughts have come from it. And listen, you don't have to invent something.
Right.
In order for us to make a difference or make a change. But hearing about what is happening and what's going on and what other people are doing definitely gives me a little more hope about what the future is going to look like, right? Yeah. So I think that's been good. It's been fun. Has there been any favorite session that you've attended?
Well, yeah, I think all the speakers have been great. And I kind of expected this to be heavy on AI. Because that's just what's emerging and everyone's talking about it. So I thought something that was a little different was the session that spoke about someone who came up with an idea to essentially use a bar of soap as a myofascial tool. Mm-hmm. And this started with just a small idea, and there's a lot that we could get into about that specific session. But what I got out of it is that a lot of people have good ideas, and it really requires somebody to just take an action, regardless of, even if that's just talking about it to someone else. Mm-hmm. So really, if you're thinking of something in the clinic, it doesn't have to be a new tool or a new device, just an idea to make something run better. Yeah. Just do it.
Yeah. Yeah. And so Dan Statz is who you're talking about, and his partner, David, they came up with this idea basically to have a soft tissue tool, assisted tool, made out of soap, right? Went to Shark Tank. They got invested in with Mark Cuban. Is that his name? Yep. Yeah. So definitely a really great story. We actually just interviewed Dan and David yesterday. Oh, cool. So that'll come out as well. But yeah, I mean, you think it's a simple concept. It wasn't like anything that's wild or crazy or anything like that, but simple concept, good concept. Anybody can use it. It doesn't just have to be a rehab professional, right? So
Exactly.
yeah, anybody can use this. So yeah, great ideas that are coming out. And I think that they're very engaging speakers as well. So I think that helped. So I'm looking forward to see what else came from or will come from their invention, their Soar Soap is what it's called, right? Yeah. Yeah. So any other things that inspired you to come to the Future of Rehab Therapy Summit other than the fact that I kind of twisted your arm?
Well,
because I mean, honestly, I was like, hey, what do you think about coming and helping me out here? Which really, you're enjoying your time,
Yeah, well, I'm very grateful for the experience, and it was kind of a call out of the blue, and I'm grateful for it. But once I started looking into it and realized I was going, something I was sitting down thinking about is that we're one of the first generations as early professionals that will most likely be treating alongside AI our entire career and whatever that progresses to. So being an early professional, I mean, this is my first year working as a clinician. It's really insightful to get some ideas from people of probably the things that we're going to be seeing in the next few years coming out. Yeah. And we're kind of getting a step ahead on that. Early professionals, typically you come into the clinic and you're kind of still developing yourself, defining who you think you want to be as a clinician. And but now people may be graduating with a step ahead of the current clinicians just because they have more experience with technology. Yeah. And so, I got really excited to hear more about that, just for the plain fact that this is something that we're probably all going to have to start using at some point in our career. And from what it seems like here, relatively soon, because it's out there. And I feel like, the people that aren't getting on board are going to get left behind most likely.
Mm-hmm. PTs across the country are calling Empower EMR the easiest platform they've used. Fast, responsive, and built for real life. Try it for yourself at empoweremr.com. You didn't start your physical therapy company just to sell it off. You built it to last. At US Physical Therapy, we help owners stay local, stay in control, and add more resources than ever before. Be a partner, not a purchase. Discover the partnership model that protects what you've built. Visit usph.com and click on Strategic Partnerships.
And you and I were just talking about this actually at breakfast this morning about all of the things that don't get captured in a true therapy session. Okay, so you're a treating clinician, you see patients every day, and they come in and you're recording what you can get into that soap note or your daily note or whatever. But there's so many things that happen during a session that's not being captured all the time. But with some of the newer technology that's coming out, there's ways that you can capture that data. So it's kind of exciting to think about what could we do with that other percentage. And I am throwing out a stat, but I don't remember exactly. So please don't quote me on this. But it was something like 10% of what you're going through in that treatment session actually really gets recorded. And then there's this whole slew of data that is really just kind of sitting there. So there are technologies now that can really kind of slice that out and kind of put it where it needs to be and belongs and things like that could give us data and direction and help us out in the future. So that's pretty important stuff. What kind of challenges or opportunities do you think are not being talked about enough in the type of setting that you're in? You're in an outpatient, hospital-based outpatient setting, correct?
Yeah. What type of problems?
Yeah, like do you think there's any problems or challenges that we're just kind of not addressing head on right now?
Well, that's a good question. A lot of the problems that, we're not addressing, I think they're probably problems that are restricted in a capacity that I don't even know yet in terms of like insurance type of problems where, I think I'm reading a book right now that I think someone on your podcast spoke about, the roadmap to insurance providers.
Oh, yeah.
And it's
shout out to Nick Hoops and Penny Goldberg. Yeah, it's
awesome.
A great book.
Mm-hmm. So there's things like that. There's lots of access problems, but I think they're trying to be addressed at state levels. In terms of accessibility and things like that, there was just a topic that we discussed where someone had developed a product and people were talking about how that probably wouldn't be feasible to get to somebody's home. So I think a lot of this has to come down to people's accessibility to care. There's been some people that asked questions when they had the interprofessional board, the conversation on stage where people were kind of getting, I guess I would say, passionate about what things are these professional organizations doing to provide more access to care and assisting the professionals in making that happen at the, kind of in the trenches. So I really think a lot of it's accessibility right now and just getting to the people that we need to get to.
Yeah. Yeah. That's definitely a challenge that I think is on a lot of rehab professionals' minds right now, is like, how do we actually get the care that needs to be there to the people it needs to be at? So you are leading an early professional SIG, right? Are you leading?
Well, no, I'm just a representative for the Southwest District of Ohio.
Don't use that
You're
word.
Right. I am.
You are a representative.
I'm not the leader of the entire SIG of Ohio for
Gotcha.
early professionals.
Okay. All right. So you're not the chair,
no,
but you are a leader within that early SIG.
Exactly.
So what kind of discussions do you think are occurring at that early professional place right now? What does that look like?
Well, I think, like I said, a lot of us are still developing who we want to be as clinicians, figuring out what we like the most, what's the most exciting for us, where do we feel like we're really providing the best care because we love it and the patients are getting the best out of it. But in terms of the future, I think, people who are just graduating are worried about passing their boards and they're studying still. So I'm not sure that, I know at me, this was not on my mind. What was the future in terms of rehab, innovation, and therapy? But people that have now been working for a few years, I'm assuming that they're probably finding, just like the question you just asked, what are the barriers and what are challenges they're facing? They're probably just getting to experience these challenges firsthand, documentation issues. Me as a new clinician, I would look around the clinic and I would see great PTs and PTAs. I mean, I go to them for advice all the time, but they're looking at their computer. And then I'm just kind of looking at my patient thinking, I'm just going to close my computer. And I'll close it. And then I just kind of, whatever plan I made, I just try and remember most of it. And then, you develop your plan based on how the patient's feedback is and all of your clinical decision making. But, I think that's a good conversation that probably everyone's having, is how, of course, no one wants to spend hours documenting. But what I found here is that it all comes down to, regardless of the product, patient-centered care. And how can we get back to one-on-one contact with the patient? And even the people that have given their presentations on AI and healthcare, it's really, of course, it's improving your time in the clinic, but it's more about the quality of care the patient's receiving. It doesn't matter if I spend an hour doing soap notes. Ultimately, it matters that that patient got, more time face-to-face with me where I wasn't buried in a computer. Yeah. So I think that's probably, at least in my experience, the main issue right now. Yeah.
Using it as an adjunct.
Right.
We're not replacing one-on-one patient care. And I think that that's been really clear here. Like you said, we're talking about ways that we can improve that patient experience, bring that value, improve our outcomes, but we're not talking about replacing any of this hands-on stuff that we do every day. So we're just talking about how we can make it easier for us to provide that good care, and different tools and different ideas and innovations that we can use to get to that point. And you also brought up students who are just wanting to pass their boards. So right now, today, as we're recording, there are PTs or PTAs out there taking their NPTE. So it is July 10th, and that means that they're, now some of them would have taken their boards yesterday. Some are taking them today. So good luck to everybody who's taking your NPTE. You're going to do great. And we cannot wait to have you join our profession here in just a few weeks once you have those results. Do you remember that
exactly
day?
1 year ago.
Yeah. You remember that day where you saw that big green pass?
Yep. It was amazing.
Right? Yeah. I was back in the ancient years where they actually had to mail you something.
Oh, no.
Yeah. So I had to wait. And I remember, this is kind of like a side conversation. We did not mean to talk about this, but I had a friend who called me and she said, "Hey, did you check your mail?" And I said, "No." Why? And she goes, "Well, they're all the results are coming out and stuff. And I was like, oh, okay. And so I walk down to the mailbox, I go get the the mail, and I bring it in, and there's this big envelope, and it's addressed to me. And I called her and I was like, hey, I was like, I got something from the board. And she was like, oh my gosh, Katie, she was like, okay, is it a big envelope or a little envelope? And I said, it's a big envelope. And she goes, you passed. Open the envelope. You passed. And I was like, how do you know? She goes, because they put your license in it. So this is like how different it was 20 years ago. And I was like, but what if they ran out of little envelopes and they're they put the failure letter, And there is nothing wrong if somebody does not pass on the first try. Right. It happens. There are ways you can change things. There's ways you can change your study habits, but that feeling of knowing that you passed is really a good feeling. And I'm excited for everybody to be getting those green checked passed signs here real soon.
And that's well, yeah, I mean, I'm thinking about them, and I know everyone will succeed, but that's a good segue into the future of rehab, because I was just texting my friends based on stories on Instagram where I think you just interviewed someone who has an Instagram where they are helping, or Instagram and a company, I think, where they are helping PTAs pass, but she will post, hey, results are coming out. Yeah. And so now we can just get them. Probably the same time frame as postal, but it's the future.
Way different than what it used to be. I had to wait for that giant envelope that I was afraid to open. But so tell me a little bit about how your background in military has helped you show up in the clinic and in your PT community.
So when I was in the military, I was a military police. I still am in the reserves, but I took on some additional duties that essentially I was creating and maintaining physical fitness plans for our unit. And I really enjoyed that. I think I don't have the statistics or the numbers anymore, but we would give reports to the commander on the improvements in physical fitness tests and things like that at monthly meetings. And so it was, the plans were working and it was fun. And I thought it was a great time. In that time, I got interested in nutrition, and I had started a pre-dietetics track in school for that, and realized that, I think it just wasn't the exact career path that I wanted. And so I was at the time coaching functional fitness with a CrossFit certification, and I've really enjoyed that. And I had a friend who was a doctor of physical therapy, and I didn't even know that physical therapist assistants were a thing. And when I was in school, I met someone who was preparing for that. And so, my mind just kept thinking about, I want to do that. And so in the military, when you're leading PT, you're in front of, anywhere from a squad, which is, 12 people, up to a battalion, which can be companies of people, which are 150 each. So you're kind of used to talking to people and being in front of people, speaking. And so I was coaching, kind of the same thing. And then I decided, this could be pretty impactful, I guess selfishly for me, because I get to the enjoyment of seeing people get better, but then other people get the enjoyment of getting better. And, that was really what made my decision. Like, this is for me. And so I changed degree plans.
Yeah. Changed. Just change that path. Yeah.
Athelis Revenue Cycle Management gives you full visibility to your money. Real-time dashboards, automated billing, and higher collections. No more guessing what's coming in. Shoot me a note and I'll get you connected today. Jimmy@ptpintcast.com.
So something you said was that attending an event like this, and I think this ties into what you were just talking about, it benefits both the clinician and the patient. So can you explain a little bit more what you mean by that attending something like this, looking at the future, like how does it help both of us?
Yeah, well, Dan, talking about Source Soap, he mentioned that he was doing a suboccipital release in the clinic, and he had time to look around, and he was just looking around the clinic thinking we can do something better. And so that, I was kind of thinking about that. It's not necessarily coming up with a new idea, but you can just look around, and that's how, you're clinicians, you can always be forward thinking. We don't have to do the same program every day for the same thing. We can think of new ideas to do maybe achieve the same outcome, but it's maybe specific for a patient. So as a clinician, you're forward thinking, and you're creating, no one says you have to do some certain intervention a certain way, unless there's like medical restrictions, but there's multiple different ways to work your glute muscles. So, doing the same exercise over and over gets boring for the patient, and I'm sure the clinician. So just in that way is innovative, but at the same time, that makes the clinician work and think and study to become better. The outcome of that is that now this patient is getting better, new, innovative care.
Yeah.
So, they're both being helped equally.
Yeah. Great. Yeah. Good stuff.
Yeah.
All right, Russ, I'm going to let you get back to the Future of Rehab Therapy
thanks.
Summit because we're just doing short snippets today. So before we go, a tradition on PT Pintcast, which this should be dual recorded. Jimmy had to step out to go to another meeting. We are in a busy place and a busy time, but we always do the parting shot, or on PTA Plus, we do the plus point. So if there's any wise words or advice or any kind of soapbox platform you want to stand on right now and tell the audience, now's your time.
Yeah, someone said something this week that I thought was pretty interesting is that, you don't have to know everything. You just have to be there and ask questions and then make a decision to do it. So if you have an idea or if there's something you're thinking about doing, just go try it. Because if you don't, someone else is going to. So if you have the idea, do it.
If
Be
you have the idea, do it.
Yep.
Yeah. Hit
Thanks
the
so
start
much.
button.
That's
Yeah.
great.
Thanks, Russ. We'll enjoy the rest of the summit and we'll talk to you later.
Thanks.
Okay. Thanks.
This isn't another online CEU course. Brooks IHL gives you hands-on mentorship, multi-site training, and a full paycheck while prepping for board certification. Find your fit at brooksihl.org. There aren't nearly enough podcasts in this world. Said no one. Why not launch one more? If you thought about launching a show but don't quite know how, we can help you do all that back-end stuff. Email me at jimmy@ptpintcast.com and we can add one more podcast no one else will listen to the pile.